Hi, I'm Dr. Prashant Bobhate. I am a pediatric cardiologist working at Kokilaben Dhirubhai Ambani Hospital, Mumbai for the last 15 years. Uh, I did my studies from KEM followed by Science, followed by Delhi, and then last 15 years I've been working in Kokilaben Ambani Hospital. See, it's extremely important to use this AI in our country. The reason is, detection of congenital heart disease is a big problem in our country. One is the prenatal diagnosis is difficult, or it is not available to most of them. Second is most of the patients with congenital heart disease go undetected, and by the time they get detected, they probably have reached an inoperable stage. So it's extremely important to have a standardized way of suspecting congenital heart disease. There is also a vast variance among physicians depending upon their experience and their education to detect congenital heart disease just by listening to the heart sounds. Stethoscope is an instrument which can be used by and is being used by most of the physicians. So what we are trying to do in association with our engineer friends is we have devised a digital stethoscope which is completely made in India, and we have done a pilot study of around 700 patients in which we recorded the patient's heart sounds in those who have congenital heart disease and those who are normal hearts, and we found that and we trained the AI algorithm to detect congenital heart disease just by listening to the heart sounds. And of those 700 patients, we got a very good sensitivity and specificity of 95 to 96% to suspect congenital heart disease. It could be a very useful tool, especially in the rural and the semi-urban areas where you don't need to do anything. Just the stethoscope the physician would put the stethoscope on the child's chest. The stethoscope would tell the physician that this child probably has congenital heart disease and you need to refer for an echocardiogram. And if this becomes successful, so the initial pilot study was successful, but we are planning to now do a multi-centric study of close to 5,000 patients all over the country. And if it is successful, if we can replicate in those 5,000 patients, and what our aim is that stethoscope should go to each Anganwadi worker, not even physician. It should go to each Anganwadi worker so that all the rural children who come in contact with that Anganwadi worker, she can just put the stethoscope. She doesn't need to listen to it also. She can just put the device on the patient's chest. The device will tell her congenital heart disease probability is yes, present or absent. If present, then she has to refer further to a pediatrician or a pediatric cardiologist for further evaluation. So that's the aim. So let's see how it goes over the next 2.5, 3 years. This should make a huge difference, because if you see Dr. Anita Saksena's paper, in which she has said that 2/3 of the patients of congenital heart disease go undetected in our country, and where we have approximately 240,000 patients who are delivered every year with congenital heart disease. If you say 2/3 of them are going undetected, that is close to 160,000 patients are going undetected, and those patients are probably becoming inoperable by the time they become. So it would be a life-changing experience for those patients who are currently going undetected just because of the lack of resources.